Ladies and gentlemen, good morning. It's my honor and pleasure to visit Vietnam again. I've been here for 3 or 4 times. The role of testosterone in the etiology and the treatment of obesity has tremendous improvement in the past decade. And I'd like to share with you in the following 2 talks. And if you have any question, don't hesitate to ask me. I would like to answer your question. Today, my talk contains 4 outlines. First, I would address the bidirectional relationship between obesity and hypogonadism. That means the severity of obesity are associated with the level of serum testosterone level. And the second is the effect of testosterone therapy on the treatment of male obesity. And the third, we will review the guideline recommendation. This is simple and easy to follow. And the fourth, the last, I would like to cover the how to active screening and treatment. Obesity is a prevalent medical disease. As before, it was seen just a sign, but now we see obesity is a medical disease. Unfortunately, the prevalence of obesity increased with age, and this is a global worldwide phenomenon. The WHO estimates more than 650 million adults have obesity worldwide. And this figure will increase. And factors contributing to obesity include 4 main factors. First, metabolic dysregulation. And second, sedentary lifestyle. And the third, inability to regulate energy intake and expenditure. And the fourth is today's focus, endocrine function disruption. And this endocrine disruption including the testes, the brain, pancreas, thyroid, and the kidney. And lifestyle modification is a cornerstone of obesity management. However, the ability to achieve and maintain clinically meaningful weight with such intervention is limited and the higher failure rates. Of course, we have alternative approach to treatment, such as pharmacotherapy or bariatric surgery, so-called the weight reduction surgery or metabolic surgery, may be associated with unacceptable side effects. So we need more effective and safety way to weight reduction. And influence of testosterone on body composition. Testosterone regulates the metabolism of carbohydrates, protein, and fat. It controls our fat cell number and their distribution. So the higher, the better. The lower, the worse the condition of obesity. A major influence on our body fat composition and muscle mass in men. I think this is a well-documented evidence. And obesity is strongly associated with lower testosterone, particularly in men with a BMI over 40. And this is a so-called marked obesity. And low testosterone level affects energy production, utilization, and results in storage of lipids, increased adipogenesis, and altered even the mitochondrial function. And low testosterone is associated with increased fat mass, particularly central obesity. You know, central obesity is very harmful to our cardiovascular system. And testosterone therapy in hypogonadal men results in normalization of glucose utilization and increased lipid oxidation. There are through two mechanisms. First is to reduce the fat cell. Second, testosterone has direct physiological on the glucose utilization and the lipid oxidation. And this slide is very interesting. You may see the title, The Striking Similarity in the Metabolic Association of Female Androgen Excess and the Male Androgen Deficiency. So obesity has quite different picture between men and the woman. So you can, if you read the literature, you will focus male hypogonadism. That means the theory is not applicable to female obesity. They have quite different appearance. You see, men with obesity is like an apple because the fat all accumulates in our visceral organ. And for women with obesity, the fat accumulates in their trunk and buttocks. And if we see their clinical picture, both are the same. Men have obesity, metabolic syndrome, decreased muscle mass, diabetes, and even the cardiovascular disease. But if we look at their hormonal profile, for men, this is the testosterone level. Men with obesity, we will have decreased testosterone level. Testosterone level will below 300, will below. But for women with obesity, he has higher level of testosterone level. That is why women with obesity have higher incidence of PCOS, polycystic ovarian syndrome, and she has irregular menstruation cycle and even has Hirsutism. That means in her body, they have higher level of testosterone. So in the treatment of obesity, we should reverse this hormone imbalance. For men, we should increase his testosterone level to break this vicious cycle. For women, we may increase her estrogen level to reverse, although there is no any data to support this. All right, and this is a very important data to show the testosterone level change in men. This is a total testosterone level. This is a free testosterone level. This is a luteinizing hormone released from pituitary gland to stimulate the secretion of testes. This is the SHBG, sex hormone binding globulin. There is still a controversy whether the testosterone will decrease with age. Some research show decline with age, but some don't. And this study supports the total testosterone level across all age remain all the same. But if you divided this group into according to their body mass index, the body mass index less than 25 with normal weight, and this is overweight, and this is obesity. And we see there is a significant difference between three groups. So the higher the BMI, the lower the testosterone level across all age. But their total testosterone level may remain the same. If you compare the patient with 20 or 30 between the 70 or 80, their total testosterone level remain the same. But if you check the free total testosterone level, decline with age. So free testosterone level reflects more our physiologic change than total testosterone. Why? Because of SHBG. SHBG will decrease with age, but increase with obesity. But will increase the obesity. And the testosterone level with sex hormone binding globulin is tightly bound, will not be released into circulation, just like a garbage can cannot be used. And we see the luteinizing hormone will increase with age. That means our body needs more testosterone after the age of 50 or 60. So now we see the prevalence and odds ratio for chronic disease to combine with hypogonadism in men. This study involves 2,000 men aged 45 years old, visiting primary care practitioner in the United States. When this study found that hypogonadism in such patients is around 40%. And the hypogonadism defined as total testosterone level 300 nanogram deciliter. And we see the condition. About 50% of obesity were found to have hypogonadism. And the type 2 DM, 50%. And some study found 40%. And the hypertension, hyperlipidemia, or osteopenia all has high prevalence of hypogonadism. And odds ratio, obesity is strongest, 2.5. Type 2 DM, 2. Hypertension, 8.8, 1.8. Hyperlipidemia, 1.4. And these are independent risk factors to predict hypogonadism. And this study has similar to my clinical experience. Adipose tissue is designed for storage our lipid. But in fact, our visceral fat also is an endocrine cell because it releases a lot of endocrine, they may have a lot of such as interleukin-6, lipoprotein lipase, or angiotensin, or insulin, IGF, or FFF, free fatty acid, or also leptin, or tissue necrosis factor alpha. And these all are called pro-inflammation cytokine. And the more this cytokine, it will compromise our endothelial function, our vascular disease, and associated with insulin resistance, hypertension, and lipidemia. And so this is a cartoon to show three main factors to involve the obesity with hypogonadism. The first is the adipose tissue contain aromatase. This enzyme will convert our testosterone to estradiol. Estradiol is not good to men because it has strong negative feedback to our pituitary gland. So it will inhibit the function of pituitary to release FS and LH. And the estrogen will also inhibit the testicular to release testosterone. And the second mechanism is the so-called pro-inflammation cytokine, such as TNF-alpha or interleukin-6. These are associated with the whole body inflammation. So the lower the testosterone level, the higher this pro-inflammation cytokine. And the third is the leptin. Leptin is released by adipose tissue. It can inhibit our appetites and cross our blood-brain barrier. But for men with obesity, they have higher serum level of leptin. But obesity, I like to eat. So we call it a leptin resistance. And leptin can inhibit the pituitary gland function. Also, now we found that leptin can inhibit the testes to release testosterone level. So now, how do we break this vicious cycle? You know, testosterone level can control the fat cell number and their distribution. But once we have more adipose tissue will increase the estrogen level, increase cytokine, and increase leptin. Now what we can do is just normalize our testosterone level, break this vicious cycle. So this is an Australian study, a randomized controlled trial of the testosterone effect on body composition in men with obesity and low testosterone. We've noticed now so far our study all confined subjects with disease and with low testosterone level. The purpose of testosterone therapy is to revert a man with low testosterone level into normal testosterone level and to see what the patient can benefit from this therapy. And this is a 1-year study, randomized, double-blind, parallel group, placebo-controlled trial conducted at the tertiary referral center to evaluate the effect of testosterone therapy on body composition over and above calorie restriction. And men, median age 53 years old with obesity, defined as a BMI over 30 kilogram square meter. And total testosterone is below 12 nanomole. It's about 350 nanogram deciliter. And who received 10 weeks of a very low diet and followed by 46 weeks of weight maintenance were randomized to receive testosterone injection and the placebo. And the main outcome measure between the group difference in fat and lean body mass measured by DEXA. This is a machine to calculate the body's total number in all whole body and the visceral area by computerized Tomos CT scan. And we can see, and this is the first 10 week, the white diamond, and the black diamond is the end of the study. After the study, the fat mass decreased in the testosterone group, decreased to 0.9, and the fat mass decreased to 0.8. And the lean body mass, that means our muscle, increased 3.4. And the visceral adipose tissue area decreased decreased to 0.7. And body weight just slightly decreased. But because the reduction of the fat tissue, I think to his general health has greatly improved. And following the resumption of normal foods as part of an energy restricted diet, men receiving testosterone therapy maintained weight loss, while men on placebo regained weight. At week 56, men receiving testosterone therapy had lost significantly more fat mass and lost more visceral fat, while regaining diet-induced loss of lean body mass versus men on placebo. So this will have good benefits to men's health. This is another study was showing the previous slides that long-term registry trial were controlled study evaluated testosterone in hypogonadal men with overweight or obesity. This is a long-term real-world study. 800 men with testosterone deficiency, defined as total testosterone below 12 nanomole, and their age 60 years old. And defined, all the subjects were defined through 3 groups: obesity, overweight, and normal weight. And about 400 men received testosterone therapy every 3 weeks, 12 weeks, and following an initial 6 weeks interval. And about 400 men received a control. And the main outcome measure is anthropoic and the metabolic parameter. We see the result. This is to show the change in body weight in hypogonadal men. They are divided 3 groups: normal weight, overweight, and obesity. The above line is the control. and the lower line is the testosterone group. Even the men with normal weight and with hypogonadism, if you receive total testosterone therapy, you will increase your body weight. Compared to normal, they will increase body weight. So hypogonadism will increase body weight if you're not treated, because the loss of control over the fat. But for overweight and obese increase slightly. But for obese men, receive testosterone therapy will reduce his body weight. So after this is an 11-year study, the most longest time, normal weight loss in men receive testosterone therapy will reduce 3.4 kilogram versus 6 in untreated men group, and overweight group will lose 8.5 versus increase 60 point gain in untreated group. And in the obesity, the treated group will lose 2.32 versus 4.2 gain in untreated group. So there will be a big difference after the end of study between the control group and treated group, even in normal overweight or obesity. Now we see the change of waist circumference, the same. In the normal group, this is the control group, this is the treated group, this is the overweight group will increase. All the control group will increase their waist circumference after 11 years. And all the treatment group, even in the normal weight or overweight obesity, will decrease their waist circumference. That means they will decrease their visceral adipose tissue area. This is another study. This is an 8-year study. The body weight divided into class 1 or class 2 or class 3 and show the change over the years. After the 8 years, all 3 groups receive testosterone therapy will decrease their body weight. And this is the same to show their mean body weight change. This is class 3, this is class 2, this is class 1. Class 1 is mild obesity, and class 2 is severe. This is marked obesity, all will increase. And this is the same. Across all obesity class, testosterone therapy was associated with significant improvement, not only their waist circumference or body weight. This is an outcome, health-related quality of life. And this is an erectile function assessed by IIF erectile function domain, and even will improve their LUT, not worsening their LUT, and assessed by IPSS. And these are validated questionnaire. Now, this is class 1, class 2, class 3, their health-related quality of life change after 8 years. Of course, the more severity of their obesity, the greater improvement in their health-related quality of life or prostate parameter or erectile function. Therefore, now we can conclude that long-term testosterone therapy improves components of the metabolic syndrome and other anthropogenic and the metabolic parameter. These anthropogenic include their body weight and the waist circumference. And irrespective of body weight at baseline, no matter you are in class 1 or class 3 severity, or no matter you are in normal weight or overweight or just obesity, all the treatment, long-term treatment in hypogonadal men was associated with improvement your body mass index, decreased your fasting blood sugar and HbA1c. As I mentioned before, there are 2 mechanisms. First, because the testosterone will reduce the number of edible tissue. The second, now the evidence shows that the testosterone, the higher the level, the better your insulin sensitivity, because the testosterone was associated with lipid and the glucose metabolism. And the third, it will improve your lipid profile, might increase your HDL and reduce your LDL, and gradual decrease in systolic and diastolic blood pressure and pulse pressure because of the fat cell loss. So now we just review some guidelines for the obesity. Body weight loss, reverse obesity-associated hypogonadism, systemic review, and meta-analysis. Now we may ask, if I don't receive testosterone therapy, just adopt lifestyle or exercise, what will happen? This is the obesity-associated so-called functional type, not a pathologic type. This is the most common hypogonadism in men. About 80%, 85% of male hypogonadism are associated with functional, such as obesity, diabetes, or age. Diet control can increase 10% T concentration, whereas bariatric surgery can increase 32%. But these are only mildly increased. And every body weight loss 5 kilograms can increase testosterone therapy 30 nanograms in average. So that's a real question. How many kilograms can you lose through diet control or exercise? And this is, if you adopt just lifestyle modification, higher failure rates. And erectile function cannot, exercise itself cannot increase testosterone concentration unless your exercise can reduce your fat. Otherwise, exercise itself alone cannot increase your testosterone level. Body weight loss could reverse obesity-associated hypogonadism, hypogonadism, but there is a high recurrence of obesity. And this review highlights the importance of testosterone therapy in men with obesity and hypogonadism, because it will help them reverse their normal testosterone level, and it may help the men to maintain their body weight. So now the final section, the key message, how to approach men with obesity to receive testosterone therapy. And these are key messages for you to deliver to our patient. First, the therapy should achieve optimal serum testosterone level between 400 and 550. Testosterone therapy is not, no matter how you take, such as oral or anything, it can achieve the same effect. So testosterone level is very important. And this is the optimal level, around 500 nanogram. And second, if you want to start your testosterone therapy, you should consider more the unique effects of testosterone therapy, such as it can decrease your fat muscle, it can stimulate your lean muscle, it can give you the vigor and your exercise performance. You know, obesity men are considered very lazy because they lack of energy to do exercise. But if you return such a man to a normal level, they will feel energy, they will feel vigor, they can do more exercise, and it will improve his general body. So you should consider more unique effect and consider the potential benefits of testosterone therapy exerting in the man with obesity. And third, the therapy should, the longer, the better for medication adherence. Yesterday, I sat with Jiann, and we asked him a question: how long do you suggest testosterone therapy for a man? His answer is lifelong. The longer, the better. Of course, in real world, it's very hard, I know. And this is the word I often communicate with my patient. Let's see what happened to you when your testosterone level have escalated to higher level. And for such as 6 months or 1 year, you may see a lot of change in your body and in your behavior, and even in your mind. And adopting healthy diets and regular exercise simultaneous is also important, because the testosterone therapy add with the exercise will have synergistic effects. You cannot say, oh, now I have testosterone therapy, so I can eat more. You will abolish your testosterone effect. The formula and the characteristic of testosterone therapy, they have transdermal, long-acting injection, and short-acting, and oral testosterone anticanoids. Oral is not recommended because it's suitable who require only very low level testosterone, not a preferred treatment option. And because it has insufficient serum testosterone level, because oral testosterone level will have past effects, will be metabolized by our liver enzyme. And it has very short action. So do not use oral form. And transdermal has many advantages, effect, and provide testosterone level with normal range for 24 hours. Those easily adjustable to individual needs. But it has some advantages. Just this advantage, potential of transfer to others. But this is only happened in one case. And long-acting injection effective maintain your serum level for 3 months, but it has advantage of pain, discomforts, and adverse reaction at injection site. Not recommended as first-line treatment option due to inability to withdraw in case of adverse events. And this is a study to show long-term pharmacokinetic of transdermal testosterone gel in hypogonadal men. Transdermal gel application can efficiently elevate serum level and free testosterone levels in hypogonadal men into the mid to upper normal range with the first day of application, and achieve steady dates within a few days and maintain serum level once daily repeated application. This shows serum testosterone level, which above the other 10 or 20 nanomole, so just the physiological level. Obesity are associated with a lot of conditions. And this table reminds you not only focus on obesity. Adequate treatment of associated disease of obese men with hypogonadism. Discuss with patient, what do you want? If the patient want to build up his muscle, lean mass, not only testosterone, you should encourage him to do resistant exercise. And muscle formation requires protein. So we should have adequate protein supplements and adequate rest, because the lean muscle mass formation needs a lot of energy. So you need a lot of rest, protein resources, and exercise, plus testosterone. It will build up your muscle very efficiently. And if you want erectile dysfunction, you should consider PDE5 first, because it has rapid onset and it can increase your penile rigidity. If you want a libido, testosterone can increase libido, but only works when you have low level. If you have normal level, if you add testosterone, it will not increase your libido. And there are many factors to affect your libido. Your healthy, your general health, your surroundings, room temperature, room loud noise will interfere your libido, and your sexual partner, and you need adequate rest. And if you want to address the vigor or validity, you should do exercise and adequate rest and decreasing your work stress. If you want to build up your bone mineral density, not only the testosterone, but also you need vitamin D and you need weight-bearing exercise, such as weightlifting, and you should have calcium index. If you want to improve your diabetes or hypertension, yes, testosterone will, but you should oral hypoglycemic agent, insulin injection to control your diabetes first. And testosterone plays an important role in muscle and skeletal system. You know, obesity are associated with osteoporosis, and all the old age men will face your decline, your muscle, and your power, and will decrease your falling, bone fracture, frailty, and sarcopenia. So for men, through all your life, exercise is very important. And the other is maintain a normal testosterone level to protect the rest of your life, because both will increase your muscle and bone. Muscle and bone problem in young adults is seldom a problem, but when you are over 60 years old, it becomes a very serious problem. So exercise and keep a normal testosterone level is very important through a man's whole life. The other challenge to our testosterone therapy in practice is, first, we have low treatment-seeking behavior, especially in Asia, especially in Vietnam. I believe this is a very common, hypogonadism is a very common disease in your daily practice, but a very, very low rate has been diagnosed. So we should find out this patient. And the second, we need the long-term adherence to medication, and the longer, the better. So we should need public awareness, and also we should continuous medical education to physicians. For public awareness, we should encourage the patient or the general population to recognize the severity of disease. And second, they build up their attitude and belief toward the men's health. And third, we should break their safety concern. And we have heard about, in fact, the prostate, the testosterone will not increase the prostate disease and will not increase your mortality. We should break the misconception of testosterone therapy. And the fourth, you know, female partner plays an important role in the men's health. So we should address this issue to female partner to ask them support. It's very effective. And for physician, we should encourage him to care their testosterone level. And this is holistic care. Testosterone covers all your body, and it meets the spirit of a general health. And this is a patient-centered care. So we should encourage testosterone in men with risk. The risk is, first, obesity, second, diabetes, osteoporosis, any with sexual dysfunction is required to screen their testosterone level. And the last, we should offer safe treatment. All right, here is a summary of my talk. First, testosterone plays a key role in carbohydrates, glucose, fat, and protein metabolism, and has a major influence on body fat composition and the muscle mass. I think this is a very, very important to all men. And second, obesity is associated with a reduced testosterone level in men. And the treatment of hypogonadism patient require adequate preparation and skill. And randomized clinical trial and the real-world evidence show that long-term testosterone therapy administration in hypogonadism men with overweight and obesity can produce significant meaning weight and improve their body composition and ameliorate components of the metabolic syndrome and associate with reduced testosterone level in men. And here is my first talk. Thank you for your listening.